Hello and welcome to the second episode of 2021. Over the past year, hunger and homelessness has been a recurring theme of this podcast, and it continues to be so in 2021 too. A lot of people were homeless, a lot of people were in need of food. The challenge with food, how to get it, how to deliver it, and how to pay for it, has emerged as one of the biggest issues of the pandemic. In 2020, the Mayor of New York and the City Council announced the city would give $200 million to non-profit food providers to buy more goods. Yet the needy are finding that many food pantries and soup kitchens they're used to visiting have closed because their volunteers, many of whom are retirees, are staying home to avoid being ill. Despite these challenges, there have been people and organizations hard at work to deliver food. One such is God's Love We Deliver, a non-profit that cooks and delivers medically tailored food to ill people. They have a very interesting story. In 1985, a hospice worker named Ganga Stone paid a visit to an AIDS patient that changed her life. The patient was too ill to cook for himself. Ganga's compassion took hold, a meal was prepared and delivered on the next visit. And that made her realize that something as basic as delivering a meal could bring dignity and recognition to a desperate situation. Ganga also realized the severity of her patient's situation demanded something more than simply delivering food. It required preparing nutritionally tailored meals that would support an individual's specific medical treatment. She researched his needs and was on her way again with a new meal in hand when she was stopped by a minister in the neighborhood who recognized her. He asked what she was doing. She told him, and he replied, "You're not just delivering food, you're delivering God's love." And that's how God's Love We Deliver was born. God's Love was founded on the simple realization that people who are very sick don't just need food, but individually tailored meals that consider the many challenges facing someone with a serious illness. Research from across the country has proven that this act of tailoring each meal to meet a client's specific medical diagnosis works. It not only improves a client's health outcomes, but also improves medication adherence and keeps clients out of the hospital and in their homes. Also, food insecurity and poor nutrition can lead to chronic health issues and frequent use of expensive medical services, and are increasingly recognized as important social determinants of health. In 2020, the God's Love team, together with their volunteers and community, hit an all-time high, cooking and home delivering more than 2.3 million meals to nearly 10,000 individuals. For their clients and their families, food is medicine and food is love. Welcome to Heroes of New York.
Hi, thanks so much for having me.
It's a pleasure to have you here. So Dorella, tell me a little bit about yourself and how long you've been working with God's Love We Deliver.
So I am currently the Senior Director of External Program Affairs at God's Love, and I started with the agency more than 20 years ago. I started as the client intake specialist. I was enrolling clients, and at the time, God's Love was only serving people with HIV and AIDS, and at the time, the medications were not working, so people were dying at the time, and that was my first experience, right? Really first job, and that was very profound in terms of the fact that the agency wanted to help people in such an important time of their lives.
What has been a transforming experience for you?
Probably the most transforming experience for me has been to know that we're making a difference, right? I love it when someone calls and says, I made it through my chemo treatment. I'm doing really well. I'm feeling so much better. I don't need your services anymore. I want to make sure that it's there for someone else. I think that has been the most transformative, tangible experience for me in terms of recognizing and valuing the fact that I'm here at this organization.
And Dorella, do you have any memorable stories that you can share with us?
Sure. I mean, I've had lots of experience with different kinds of people. So, at the early onset of the pandemic, HIV pandemic, I would get calls from people that were very young, and young meaning between their 20s and early 40s. And, they were alone. Their families had abandoned them, and they were scared. And I felt that God's love was just doing that, right? Offering love to that person in terms of the food that's being provided, right? And that was one less thing that they had to worry about. And some of them had children, so they were like in awe of the fact that we could provide meals to their children, and that was just one less thing to worry about. Another story would be when the medications for people with HIV started working really well, which is fantastic. We were also getting requests from people that had other diagnoses, think breast cancer or lung cancer. And at the time we had to say, no, you're not eligible for our program. So I was so excited when we expanded our mission and I was able to start conversations with people that I had to say no to, like a woman that was dealing with metastatic breast cancer. And, metastatic breast cancer, the medications can sometimes, have you feeling great, but sometimes you're really down for the count. And that was just transformative. It changed her whole experience because she was too young, let's say, for like a Meals on Wheels service. And we were the only provider that could really get nutritious meals to her. So I think that's a profound story I remember. And I can tell you that we, for the holidays, we're seeing our clients. Sometimes they're alone. Sometimes the only guest that they have is the home health aide. And when we're delivering that Thanksgiving feast as an example, right? It's a holiday celebration. We send one for a guest, and it changes a person's sense of self. So I have lots of memories of clients calling saying, I was so glad that I could, prepare the table and your meals, and I had the basket of goodies, and it just makes a person, right? They've said to me, it makes them feel more like themselves, right? More empowered. Because sometimes when you're sick, you feel like you're not part of society the same way, right? It's a sense of isolation and separateness, which, we've experienced through this new pandemic, right? COVID-19. And at the height of COVID-19, I was getting calls from every kind of person you can imagine because people were afraid and people were still getting sick with other things in addition to COVID. So there was this one family that, one family member had COVID. They really couldn't get out and shop the same way, right? This was during the spring of 2020. And we were like, don't worry, we're an essential provider. We're going to come and we're going to deliver. And, don't be afraid. And it was so fascinating to see our clients, worried about our drivers' safety, but so thankful that we were still in play. Because I think that was the scariest thing for a lot of our clients. We got a lot of calls saying, are you going to still be able to come to me? And, we were, as an organization, so proud that we were able to say, yes, we're going to do this. We're going to be able to come and deliver to you. We're not sure what's happening because everything was changing week to week. But we were at least so excited that we could continue operating. But the whole, COVID spacing thing was a challenge, right? Because we couldn't have the same amount of people preparing meals. So we changed the timing of our deliveries, all of that, but we were still able to get to people's homes and serve them, serve new people too.
That's incredible. What I hear from your stories are that food can fill someone's stomach and also fill that emptiness in their soul. And you seem to have that perfect role there. What are some of the lessons that you've learned from 2020 as a team?
I think as a team, we are more resilient than we thought, right? Like it has presented us with a problem, right, that we've never prepared for. And I think you can equate it to other times where we've been faced with an anomaly, right? We had the experience of, 9/11, and the building is downtown, and, our operations were kind of cut off. We had to reinterpret how we were going to reach our clients, how do we get in contact with them, and then how do we get them the food that they need. And if for some reason we can't, what's the alternative? So for this pandemic, we had to shift to having some staff work remotely, but that remote action didn't mean that we weren't going to be responsive to our clients, right? So people were calling all day. Are you coming? Are you still operating? Are you safe? I have enough here right now. You can come back in a few days, and that was just very moving that the people that we serve understood the gravity of the situation and demonstrated concern for us and our drivers and our volunteers. And I think that spoke volumes, right, of the humanity, right, of the people in our city. We're great, resilient individuals in our city. So, I think people sometimes approach us or reach out to us because they're coming from a place of fear, right? Fear and isolation. And our job in responding to them, right, in that call, being compassionate, being respectful, meeting them at that moment without judgment is something that helps to transform both the person that's in need of our service and us being able to be present and provide it.
Absolutely. And Dorella, what do you think, from your experience, and you spoke about transformation, from your experience, what is your message to our listeners?
I think it's important for your listeners to remember that while a moment may seem challenging, right, it's all about working together, working collaboratively to try to find the solution. And sometimes the anticipation is that the solution needs to be perfect, and it doesn't need to be perfect. The question is, can you figure out what you can do and what is it that you can do well? So as an example for us, if all of a sudden we've lost power, there's a massive snowstorm, what is it that we can do? If we knew the snowstorm's coming, we're going to pack meals that are in advance, sometimes non-perishable goods, but if we can send our normal meals and send it out to the clients and make sure that they have enough in their home so that if we can't get out, they're okay, right? The goal is to make sure that people are okay. And doing that with intention, with respect and compassion for the other, I think that is what changes things, right? That's what changes our city, changes our world. And we have been, all of us through this COVID-19 pandemic, been through so much. But the opportunity to help the other is what really has moved us, right? You think of the frontline workers, you think about us in terms of volunteers. We couldn't have them volunteer the same way. So people working from home were able to come in their cars, pick up meals, and then deliver in their own. That has been transformative for us because it didn't exist as a model beforehand. So I think it's all important to think about how can I help, and whether it is a donation or whether it is, helping to distribute meals. I think that's the important thing that, everyone can understand that they can do.
Absolutely. What are some of the common misunderstandings about people who are sick or unable to fend for themselves?
I think sometimes people have preconceived notions that somehow someone got sick because it was their fault, right? And it's not, right? It's a health factor. Someone who's 25 years old never expects that they're going to get breast cancer and that they're going to need surgery, chemotherapy, and radiation. So the assumption that they should be self-sufficient during that experience, that they should have more than enough money to take care of themselves while not working for 6 months to maybe later than that, a year, is a flawed thinking, right? Whereas if you have the comprehension that, someone sometimes has a difficult moment, and that can be defined in any number of ways, whether it be a substance use problem or a housing problem because someone couldn't pay their rent or whatever it is. Respect that the person is experiencing something, don't judge it, and meet them where they are, right? How is it that you can help support them at that moment? And I think, that's called like a harm reduction model from the perspective of no judgment and actually kind of accepting where that person is and whatever they can deal with. So some of our clients live in single room occupancy hotels. I'm sure you heard about that during the time. And what we're able to do is we're able to go to that building, get them the meals that they need, even if they only have like a small microwave to reheat the meals, and they're still able to have the nutritious food that they need.
Dorella, how can our listeners help?
I think your listeners can help by donating to God's Love, can volunteer. We are outnumbered by volunteers. I think it's 5 to 1 at stats. So volunteers are all over the place. They help us with office work. They help us with delivering. They help us with the kitchen work. So that's always something that we love, right? They are our lifeline. And that's the best thing that you can do. But then also just recognize, be kind to one another, be, compassionate, especially during this time of the pandemic. It is a strange time, but we're all going to get through it.
Absolutely. Thank you so much, Dorella, for such a positive and encouraging message, plus instructions to our listeners on how they can help. This has been a real pleasure, and I wish you and your team the very best for 2021.
Thank you. The same to you.